this is Dr. Kate, and today we're going to talk about why I chose the shockwave that I did for our practice and the different types that there are. So shockwave is the same thing as lithotripsy, where that they use sound waves to break up kidney stones so that you can pee it out. They've been using this in urology for decades with great success. Then they discovered that those shock waves increase blood flow and stimulate cell regeneration. Usually we tell people when they come in that it decreases calcification, it increases blood flow, and then it stimulates cell regeneration. The first two things that happen are important. They help with healing. We love them. But the thing that keeps people feeling better for such a long time and gives us those best results is the cell regeneration. And that takes time. That takes 2 to 3 months after each treatment to fully happen. So the cell regeneration is what we want. It's the most important part. And it's part of the reason why I picked the machine that I did. Other things in the musculoskeletal field that stimulate cell regeneration are PRP injections and stem cell therapy. So shockwave therapy is, the intro level price point. PRP injections are the next price level. They're a lot more than shockwave, but still less than stem cell therapy. And that is the highest priced cell regeneration thing that you can do. With shockwave therapy, there is focused shockwave therapy and radial shockwave. Now, both things are sound waves. Just like lithotripsy is a sound wave, focused shockwave is a sound wave, radial shockwave is a sound wave, even ultrasound, which is a different therapy, are sound waves. Now, what makes ultrasound different from shockwave is that those waves are really small and stuck together and compressed, so they cause heat within the body. That is why we don't use them over implants or anything like that. Because of the heat, it will heat up what's in your body, and we don't want that. So with focused shockwave, the sound wave is so big in amplitude that makes it a shockwave. So it turns it from just a sound wave to a shockwave, the amplitude of the wave. Now, radial shockwave, even though it's called shockwave, is not true shockwave. It does not have the amplitude of a real true shockwave. It is a pressure wave. So is it still a sound wave? Yes. So is ultrasound, but it is not a shockwave. It is a pressure wave. So they work differently. So radial shockwave still decreases calcification and increases blood flow, both things that focused shockwave does. But what it doesn't do well is it does not stimulate cell regeneration because the amplitude of the sound wave is not big enough. The other thing with it is it works more like a shotgun blast. The radial pressure wave hits the surface or your skin, and then it disperses out and gets weaker as it goes further into your tissue. So if you want to affect tissue deeper with radial shockwave, you're going to turn up the power to get the sound waves in deeper. So it's going to feel more intense at the surface the harder you go in to get deeper to the deeper structures. So with focused shockwave, we're only treating specifically the depth that we're going into the tissue. So there's no turning it up to get deeper. The sound wave comes out of the treatment head, and then where you feel it the most is the apex of the sound wave. So we have all these different pads for our machine, which is a piezo wave focused shockwave, and each pad is a specific depth into the tissue. So we know exactly where we're going into the tissue because that's the apex of the sound wave, and we're gonna hit right at 0.5 centimeter in. We're gonna hit right at 3 centimeters in. So we know where we're going, and we do not have to turn up the pressure. We do not have to increase the feel of it to be able to get that deep. Plus it's concentrated. It's not working out like a shotgun blast. It's staying concentrated more like a sniper rather than a shotgun. So it gets way better in depth and more specific than radial shockwave, and it picks up where the areas of concern is. So with radial shockwave, you kind of feel the pressure everywhere while it's being done. I found the focus shockwave to be more diagnostic because it does not feel like anything on healthy tissue, and you only feel that achiness when it hits an area of calcification that we want to treat. So it really helps me decide like which structure is the issue and what we want to laser focus in on and treat, how we want to give exercises out, that kind of thing. And we also are able to get deep into like the bone itself, into the subchondral bone. And because of the cell regeneration part of it, it will increase cartilage growth, unlike radial shockwave. So when I was first looking into all the different types of shockwave, I had a rep come to my office and brought 2 machines with him. He brought a piezo wave, which is focus shockwave, and that's what we ended up getting. And he brought a radial shockwave, so I could feel the difference, because you would think if the one is better, it creates cell regeneration, it can go deeper, it's more accurate, all of these things. It seems like it would be an easy choice which one to pick. But radial shockwave is typically about 1/3 of the price of focus shockwave. So he brought it just so that I could see the difference in what you're paying more for. I had both done to me, and I definitely could feel instantly that the focus shockwave picked up right where my issue was, and radial shockwave, I just kind of felt it more dispersed everywhere rather than figuring out exactly what was wrong. And reading the research and knowing that we can increase cartilage growth with focus shockwave, we can speed up bone fracture non-healing, we can stimulate that cell regeneration, which is so important. I read some studies where for those shallower structures that radial shockwave can treat equally or get to as equal as focus shockwave, like plantar fasciitis or elbow pain, they got similar results after the 6 visits initially, but where the difference was that we see with our patients is that when they retested those sample studies from both groups at 24 weeks out and 48 weeks out, the radial shockwave patients' symptoms had returned, and the focus shockwave patients still had pain relief. That is the magical part of cell regeneration. That's what makes it so phenomenal. That's what gives you those crazy good results, is the more permanent fix to it. So while they might seem similar on those shallower things in the short term, the long-term benefit is hands down focus shockwave. Now, do you have to be more careful, more precise, because you are going deeper? Of course. And we have been to tons of trainings on how to use it specifically. They are coming out with an even deeper head where we'll be treating more deep hip joint, lumbar disc stuff, and we're going to do even more training with that because safety of patients is always our utmost concern. We've done over 11,000 shockwave treatments and we've never had any issue. We really try to go in with a lot of thought to everything that we invest in for the office, and that is why I did all the research. I tried out the radial, I tried out the focused, I looked at the research, and I knew that I wanted to be able to get that cell regeneration part. Now, paying 3 times the price for a machine is a tough pill to swallow, but I thought it was worth it, and it has really done so many good things for our patients that I would really highly recommend it to any of my colleagues. There are focus shockwave units out there that are more expensive than the one that we have, and they classify themselves as focused, unfocused, and they say that they have less pain with their treatments because it's more dispersed when it comes out than ours. I find that in using our equipment, even though the people might have a little more pain or discomfort during treatment, the results are just as good or even better because we are able to be a little more precise with the depth because of the pad system that we use. in knowing exactly what structures you're getting into when you're using those precision type pads. So it was a little bit of a cost savings, but also, you know, being able to tailor it to the patient and possibly have a little more soreness, but be a little more specific. So if you have any questions about the different types of shockwave, feel free to reach out to me. I'd love to answer any of your questions.